What is the success rate of a knee replacement revision surgery? Time is the biggest factor affecting the success rate, and the stats that we have pulled from the National Institute of Health is 90% successful at 5 years after having the revision done, and then it's 75 to 80% successful at 10 years after having the revision done. And then after that, it gets worse over time, the success rate. So time is the number one thing because things tend to break down and not function as well as time goes by. Now there's something that can help mitigate the breakdown over time. I'll tell you more about that towards the end of the video, but let me tell you some other factors first that can affect the success rate of a revision surgery for a knee replacement. The first thing is the type of knee replacement you have, because you may have had a partial knee replacement where only one side of the knee joint is replaced, or a total knee replacement where the entire knee joint is replaced. There's also cemented versus non-cemented, which has to do with any materials that they use to stick the artificial metal parts onto the ends of the shaved bones, or they don't use it, they just allow bone healing into the ways that the artificial part is developed. You can look into it. I've actually got a video going into cemented versus non-cemented. But there's also robotic assisted knee replacement surgeries versus traditional or manual, in other words, where the surgeon doesn't use a robot to perform the surgery. There's also the stems on the artificial parts of the knee replacement, and that has to do with a long metal part that goes down into the shaft of the bone on the shin bone or on the thigh bone that helps to hold the bone in place. Depending on how long the stem is, depending on what your surgeon decides, that could affect the success rate of your revision surgery as well. Now, your health going into the revision surgery is a big deal too, especially if you had an infection. If that's the reason why you're getting a revision surgery, then your health is not going to be very good. So that can influence your recovery time and the success rate of your revision surgery afterwards. But if you didn't have an infection, if you've been dealing with chronic pain prior, then your strength levels and how disabled you are, if you have a disability as far as like not being able to walk as much as you want or move around the way that you normally would, that can also influence your success rate afterwards. Your bone health is related to that. So like if you have osteoporosis, then that's going to negatively influence the success rate. Now, other factors include the surgeon's skill level, because some surgeons are just more experienced or better trained at it than others. Also, the hospital success rate at this is often tracked, and you can usually find this information if you dig or ask for it at the hospitals that are nearby you. The physical therapy treatment that is done in recovery afterwards, after the revision is done, can also influence the success rate, and then your compliance as a patient to doing the physical therapy exercises or treatments, whatever they have you doing, is also another factor. Now, muscle imbalances are the overlooked key, and this is when muscles compensate for other muscles that aren't doing their job, which ends up influencing the forces going through the knee joint. This means that you're going to get abnormal forces, or it's going to be too much pressure on one side or another side of the knee joint, and that's going to cause the knee joint to move inappropriately. And gradually over time, this starts to affect the hardware that it's installed during the revision surgery, and this can lead to a sooner failure. Now, this is what I'm talking about. If you can correct a muscle imbalance, even after you've had a replacement surgery or even a revision surgery, you improve your chances of allowing that replacement surgery, whether it's a revision or a first-time replacement, to last longer. In other words, you have a better success rate because you can normalize the pressures inside the knee joint, which allows you to not injure it, to keep it healthy for the long term. Now, I've got lots of videos here on this channel that talk about correcting muscle imbalances, specifically with knee replacements and revisions to knee replacements. You can find them on our playlist called Knee Replacement Pain Help. It's linked in the description below. And I've also developed a program called the Failed Knee Replacement Recovery Program, which is a comprehensive online program that walks you through all the steps to get your chronic knee pain after having a knee replacement under control and fix the muscle imbalance. You can learn more about that program through a link in the description below. Hey, if this video was helpful for you, please give us a thumbs up. Please subscribe to our channel and turn on our notification bell so that you don't miss out on any of the helpful videos. And please share this with somebody that you think needs to hear this. Thanks so much, and I'll see you in the next video. Bye-bye.